Hello students, in the continuation of Norma Basalis, today we will discuss the part 3. As I already told you that when we are reading this Norma Basalis, we divide it into the 3 parts. This is the first part, then you have an imaginary line in front of the foramen magnum, that is known as second part, and then the third part. So today we will discuss this third part of Norma Basalis. So when you will have the Norma Basalis posterior most part, again that posterior most part for the study purpose divided into the 2 area, the area that is in the middle portion, that is median area, and the right and left lateral areas. So when you will see the area which is behind this imaginary line, you can divide it again into the 2 different parts. So first we will see this portion and then we will talk about the lateral portions. Clear? So let's discuss the median area of the posterior part of Norma Basalis. So in this median area, you have first identify the bony landmarks from anterior to posterior side. So in this area, if I will start from here, so this is the foramen magnum. Clear? So what is this? This is the largest foramen. It is known as foramen magnum. Now behind the foramen magnum, you will start a bony line, and this median line which is in the mid plane is the external occipital crest. Now you will trace this crest. This crest will end at a bony point, and that point is known as external occipital protuberance, and from the protuberance you are having the side lines which are known as knuckle lines. Clear? So when you will have the median area, in this median area you will have the foramen magnum, you will have this ridge which is known as external occipital crest. The crest will end at a point is known as protuberance, and from this you will have the knuckle lines. So now let's talk about the foramen magnum. Sometimes you have even the question in your theory exam also, the features of foramen magnum apart from the spotting. So the first thing is that it is the largest foramen of the skull. It opens upward into the posterior cranial fossa, and downward you know that it continues with the canal which is present in the vertebral column is known as vertebral canal. It is oval in shape, and because of this oval you have the wider area posteriorly than the front. That means if you will see this, the diameter of posterior area is more as compared to the diameter of anterior area. Now anteriorly it is overlapped on each side by the occipital condyles. So when you will see the placement of the occipital condyles, these are the occipital condyles. Now these occipital condyles are going to make a joint with the superior surface of your first cervical vertebrae, and the another important thing is that on the medial side of these occipital condyles you are having the tubercles. Now where are these tubercles? So when you will see the tubercles, these are the 2 tubercles. Now these tubercles are projecting from the inner margin of occipital condyles, and these are known as tubercle of occipital condyles. Now these tubercle will provide attachment to the alar ligament that we will see in the subsequent slides. Now there is one more point is known as basion. Now what is basion? Basion is a midpoint of anterior margin of foramen magnum. So this is the anterior margin of foramen magnum. This middle point is known as basion. Clear? So what are the important features in this slide? What is basion? What is the occipital condyles? What are the tubercles of occipital condyles? Then you have the structures attached to the different areas of the foramen magnum. First we will see the structure attached on the margins. Now when you will see the margins, we will see the attachment on the anterior margin, we will see the attachment on the posterior margin, and we will see the attachment on the lateral margin where you will have these tubercles of occipital condyle. So on the anterior margin, on this anterior margin you will have the attachment of anterior atlanto-occipital membrane. On this posterior margin you will have the attachment of posterior atlanto-occipital membrane, and on these side tubercles on the both side, on the medial side of these condyles, you will have attachment of alar ligaments. So we will see the images for these 3 different attachments. Now here you can see the posterior view. In the posterior view you will find this posterior atlanto-occipital membrane. Clear? So it is attached in the lower part to the C1 vertebrae, and in upper part you can see that it is attached to the posterior margin. In the same way here you can see the anterior atlanto-occipital membrane. Now this is the anterior part of C1 where you will have the upper border, and this is the anterior margin of foramen magnum. Now, in between these two, you will have this membrane is anterior atlanto-occipital membrane. Then we have the side attachment that is on the margins. On the margins, you can see this is the apical ligament of Dance, which represent actually the body of C1, and it continue with the body of C2. Clear? Now, from this apical ligament, from the lateral side, you can see these green color extensions. These are known as LR ligament, which will go and attach to these inner projections, which are known as tubercles of occipital condyles. So, these are the three important attachment on the margin: anteriorly, anterior membrane; posteriorly, posterior membrane; and on the sides, you will have the LR ligament. Now, when you will have the LR ligament, it is said that this LR ligament attachment divide the foramen into the two part, anterior compartment and posterior compartment. Now, here you can see that posterior compartment is larger and anterior compartment is smaller. So, first we will see the structure in anterior compartment, and then we will see the structure in posterior compartment of foramen magnum. So, what are the structure present in the anterior compartment of foramen magnum? In anterior compartment of foramen magnum, you will have the three important relations: apical ligament of Dance, superior longitudinal band of cruciform ligament, and membrana tactoria. Now, my dear students, you have to keep this thing in mind that these three areas, these three structures, when they will enter through this anterior part of the foramen magnum, as soon as these areas, this anterior compartment will give entry to these three areas from anterior to posterior, all these three structure will go and they will attach on this inner side of the occipital bone, and this part, I am talking about this part, the inner side of this part is known as clivus. So, when you will see the cranial cavity from inner side, you will find a sloped area here. That sloped area is known as clivus. So, all these three structures will enter into the foramen magnum through the anterior part, and they will get attached on the inner side of this basilar part of the occipital bone, which is forming the clivus. Clear? So, you have to keep this thing in mind that anterior part of the foramen magnum give entry to the three structures: apical ligament of Dance, superior longitudinal band of the cruciform ligament, and membrana tactoria. Now, membrana tactoria is a continuation of posterior longitudinal ligament of vertebral column. So, we will see here one by one these structure. Now, this is what I am talking about when you will see from the cranial cavity. Now, this is known as clivus. Now, this inner area is known as clivus. Now, on the inner side of the clivus, here you can see there is a attachment of the apical ligament of Dance. So, this is the apical ligament of Dance. Now, this is the upper end of the apical ligament. This is the lower end of apical ligament. This lower end attached on the superior part of this odontoid process or Dance. Clear? So, this is the one structure, that is apical ligament of Dance. Now, here also you can see from the inferior side that this apical ligament is going inside the foramen magnum. Then you will have the superior longitudinal band of cruciform ligament. Now, this cruciform ligament is present in the cross shape. Now, in this cross, you can see that the horizontal bands are there and the two vertical band are there. Now, this is the lower end of the cruciform ligament, this is the upper end. Now, this upper end is again attached on the inner side of the clivus once it enters into the foramen magnum, but in the anterior part. Now, this is the last thing which enter into the anterior part of the foramen magnum is known as membrana tactoria. Now, here you can see this is the posterior surface of your vertebral bodies. Now, on the posterior side of the vertebral bodies, you are having the ligament which is known as posterior longitudinal ligament. Now, this posterior longitudinal ligament will end at this junction of lower border of C2. Now, after the C2, this posterior longitudinal ligament broaden itself, and this is known as membrana tactoria. Now, this membrana tactoria enters inside the foramen magnum, and it get attached on this part of the clivus, which is a sloped area present in the posterior cranial fossa. Clear? So, there are three structures which we have seen entered into the foramen magnum, but through the anterior part. What are they? Apical ligament of Dance, then you will have the superior part of the cruciform ligament and membrana tactoria. Now, what are the structure through the posterior part? As I told you, posterior part is a larger part, so you will but obviously have the larger structure, and the posterior part allow very important nerve and vessels. That's why it is known as neurovascular compartment. So the most important neuronal tissue is medulla oblongata. So this is the posterior part of your foramen magnum. In this you will find the medulla oblongata enters or come out. Then you will have the meninges, you will have a spinal root of the accessory nerve, meningeal branch of C1 to C3, then you will have fourth part of the vertebral artery along with the plexus around the artery, and you will have anterior and posterior spinal arteries. So these structures will enter through the area which is posteriorly placed behind this line, which is the line connecting the two tubercles of occipital condyles. So let's discuss these structures. So if you will see these images, you have to understand that this is what we are seeing from the cranial cavity. Now you know that in the cranial cavity, when you will see the posterior cranial fossa, you are having the brain stem. Here you can see that there are the three parts. This is the upper part of the brain stem, which is known as the midbrain. Then you will have the pons, and in the lower part you can see here, this is your medulla. So this medulla is present here, and the sum of the lower part will come out from this your foramen magnum. Now here what you are able to see, now we are talking about the spinal accessory nerve. Now when you will see the spinal accessory nerve, here you can see that this part, this area is going to form your jugular foramen through which the spinal accessory nerve will come out. But you have to understand that this spinal accessory nerve is first enter from the spinal cord, it will arise from the spinal cord. It enters here, you can see that this is the entry of the spinal accessory nerve inside the cranial cavity, and then it will come out from this jugular foramen. Clear? So here you can see these are the origin of the different roots of the spinal part of the accessory nerve, and then the nerve will form. This nerve will enter into this foramen magnum. Here you can see the loop, and then it will join this cranial part, and later on it will come out. Clear? So this is the important thing to understand, that spinal accessory nerve is having two parts, spinal this cranial part and the cervical part. Now this cervical part, or you can say the spinal part of the accessory nerve, form into the lower part of the medulla oblongata, and then it enters into the foramen magnum, join with the cranial part, and then it will come out through this jugular foramen. Then you will have the vertebral arteries and spinal arteries. Now in this image you can see the posterior side, and in the posterior part what you can see that this is the vertebral artery. Now this vertebral artery, as soon as it will approach here, now this is from here up to the foramen magnum, this is your third part of the artery, and once it will enter, you will have the fourth part. So this vertebral artery, here you can see that this is the vertebral artery, and this artery is passing through the foramen transversarium, which are present here, and this vertebral artery is then making a loop, and then it enters through the foramen magnum inside the cranial cavity. Now apart from that, you can see that this is the anterior spinal artery. Now this anterior spinal artery runs along the anterior or ventral surface of your spinal cord, and then it also enters inside through this foramen magnum. Clear? So what are the structures passes through the foramen magnum? You should divide into the anterior part and posterior part. Now we will see the next bony feature is external occipital crest. Now I told you that this crest starts from the posterior margin of the foramen magnum, and it ends at the external occipital protuberance. Now the important thing is that this is the junction of your back of the neck and your back of the scalp. So this is the junction where you will have the upper part is known as scalp, lower part is known as neck. And when you will talk about the attachment on the crest, here you can see that this white color ligament. Now this ligament is attached along the whole length of your crest, and this ligament is known as ligamentum nuchae. So this is the question. So many times you have this question again and again in exam, that which is the structure lies or attached on the external occipital crest. So your answer has to be the ligamentum nuchae. Now you have the nuchal lines. We have already discussed the lines in the norma occipitalis, but here again you can see that the lines are present which are known as highest. These are the highest nuchal lines which are here. Then you will have the superior nuchal line, and you will have the inferior nuchal line. The highest nuchal line may be present, may not be present, but these are the constant findings. Clear? So the lines will start from the midline and then they will show the curvature on the lateral sides. Now we'll talk about the lateral part of the posterior area. So we have discussed this midline where we have seen the foramen magnum, you have seen the crest, occipital, protuberance. Now in this part, when you will see the lateral side, you will find the condylar part of occipital bone, you will find a squamous part of occipital bone, styloid process, mastoid process, and the most important is jugular foramen between the occipital bone and temporal bone. So in nutshell, you have to keep this thing in mind that when you are reading this norma basalis, behind this imaginary line, you are mainly going to deal with the two bones. One is the part of the temporal bone which is visible here and the major portion of occipital bone. So let's discuss these areas one by one. So here you can see that this is the inferior view where you are dividing the this occipital bone in the three part. Now this is the major portion behind this line. Now this is the foramen magnum and these are the two imaginary line which we are drawing here. Now this is the major portion which is known as squamous part of your occipital bone. Clear? Now this area which is anteriorly placed, now this is your basilar part of occipital bone and these are your condylar part of occipital bone. So when you are seeing the norma basalis posteriorly, you are going to see major portion of your occipital bone. Squamous part is most posteriorly. On both the side of your foramen magnum, you are having the occipital condyles which are actually related with this condylar part, and the anterior part of your occipital bone which is going to make it joint with the posterior body of sphenoid is your basilar part. Clear? So here again, if you will mark these areas on this image, where is the different parts? So this is your squamous part of your occipital bone. Now this anterior part is now become the basilar part of your occipital bone, and these are the two condyles. Now you have to keep this thing in mind that behind the condyles you are having the two depressions which are known as condylar fossa, and these condylar fossas are also part of condylar part. So you cannot draw the line here. Now if you will draw the line here, then these fossas are become the part of squamous area. So for the these demarcation between the squamous part and your condylar part, you have to draw the line here. Now this is the area. Clear? So if you will draw the line here, now you can see that these depressions behind these condyles which are known as condylar fossa are the part of your condylar part of occipital bone. So here you can see these are the two condylar fossa and these lies behind the posterior end of occipital condyle. So in this way you can see this is the squamous part, this is your condylar part of occipital bone, this is the basilar part of the occipital bone, and you will find the temporal bone. So this is the temporal bone, you can see the suture line is here. So this is the mastoid part, here you will have the styloid process. Clear? So let's discuss these areas one by one. So first is the features of condylar part. Now in the condylar part, I told you there is a major feature or the most important feature is occipital condyles. Then you will have hypoglossal canal. Now this hypoglossal canal lies in front of the condyles. So these are known as anterior condylar canal. Then behind the condyle, I told you there is a presence of depression is known as condylar fossa. Sometimes the fossas are also having a canal that is known as posterior condylar canal and the jugular process of occipital bone. So now again, if you will see this image, if you will have the bone in your hand and you have to mark these bony areas on the bone, where to mark? So again you have to first mark the area behind the occipital condyles. Now the area behind the occipital condyles is known as condylar fossa. Now you have to keep this thing in mind, behind the condylar fossa, if you will draw a line, then you are making a junction between the squamous part of occipital bone and condylar part of occipital bone. Clear? So this is the condylar part of occipital bone, this is the squamous part of occipital bone. So here you will have the occipital condyles which are here. Clear? Then you will have the hypoglossal canal. Now hypoglossal canal is not visible because that is present on anterior aspect. Then you will have condylar fossa with a small foramen which may be present. If it is present, it is known as posterior condylar canal and jugular process. So this anterior border of your condylar part is known as jugular process. Clear? So what are the features of occipital condyle? So occipital condyles are oval in shape. You can see that they are kidney shape or oval shape. They are situated on each side of the anterior part of foramen magnum, and their long axis is always faces medially. So this is the long axis which is faces medially. They articulate with the superior articular facet of the C1, that is atlas, and that joint is known as atlanto-occipital joint, and you know that atlanto-occipital joint is a synovial variety of joint. Now what is hypoglossal canal? Now hypoglossal canal is known as anterior condylar canal. Now this is the important thing which you have to understand, that if you want to see the hypoglossal canal, you have to look the norma basalis from front. Now when you will hold this skull in such a way, you can see that just above and on anterior aspect of both the condyles, you will find a small external opening, and this external opening is for the hypoglossal canal. So hypoglossal canal lies on have the outer opening just lateral to the anterior part of occipital condyle. So this is my sincere suggestion, that if you want to see the anterior opening of hypoglossal canal, you have to hold the skull in such a way, and you will find that there is an opening on the upper part of the occipital condyles on both the sides. Now this hypoglossal canal transmits the hypoglossal nerve, which is the most important content. Apart from that, you will have meningeal branch of ascending pharyngeal artery and emissary vein. Now here in this image, you can see where is the hypoglossal canal. So again you have to look for the occipital condyle. So these are the two anterior margin of occipital condyle. Now above that, you can see that this is the opening, anterior opening of hypoglossal canal, and through this canal you can see that this is your hypoglossal nerve which is coming out. Clear? Now what is the condylar fossa? Now this is very important question. Now this line is a very important spotting question for your exam. What is the importance of condylar fossa? So the first thing is that what is the location of condylar fossa? I am saying this again and again, that this is now the posterior view, and here you will find the depression behind the both side of your occipital condyle. So condylar fossa present behind the occipital condyles. Now the second thing is, what is the importance? Why there is a depression behind the occipital condyle? The answer is that during the full extension of your head, that means when I am doing this full extension of my head, what will happen? This fossa accommodates the upturned posterior margin of superior articular facet of atlas. You have to keep this thing in mind, that when you are talking about the articular facet of atlas, it is of this shape. Now when you are doing the complete flexion, this posterior projection will go and accommodate in the fossa. Now for that you have to see this image. Now in these two images, you can see that first the condylar fossas are behind the occipital condyle. Now when you will articulate this with the C1, now this is the C1. Now here you can see that this is the posterior projection of C1. Clear? So this is the skull, which is now if you will place on this C1, and if you will do this movement, when you are doing the full extension, you are taking your head posteriorly, what will happen? This bone is not moving, the C1 is fixed, and you are having the movement on the joint which is here, that is known as atlanto-occipital joint. So at this joint, when the C1 is fixed and your head is going posteriorly, this posterior projection which I am talking about will accommodate in this fossa. So this is your fossa which is present here, which we are talking about, and this fossa is known as the condylar fossa. So when you are having the complete flexion, what will happen? This posterior projection of your superior articular facet of C1 will accommodate in this fossa. Clear? So this is the important question for your exam, which has been asked so many times, that what is the importance of condylar fossa? The only answer is that at the time of full extension of your head, this posterior projection of superior articular surface of C1 accommodate in this fossa. Clear? Now, occasionally, sometimes I told you that this fossa may be perforated by a small canal, and that is known as posterior condylar canal. Clear? So, a canal is present anteriorly, that is hypoglossal canal. A canal present posteriorly is known as posterior condylar canal. Now, superiorly, this canal opens or communicate with the sigmoid sulcus, which is having the sigmoid sinus. So, there is a emissary vein is passing through this foramen. So, when you will see this foramen allow the passage of a emissary vein. Inside this vein is communicating with the sigmoid sinus, and outside this vein is communicating with a venous plexus, which is known as suboccipital venous plexus. Clear? So, as you know, emissary veins are the connection between the intracranial and extracranial venous system. So, here the intracranial component is sigmoid sinus and extracranial venous component is suboccipital venous plexus. Now, we will talk about the squamous part. Now, this is the squamous part, which is the largest area of your occipital bone visible in this view. But you are only having the important landmarks are the knuckle lines, and we have already done these knuckle lines in the different parts of our norma occipitalis. Now, what is the jugular process? Now, again, this is very important to understand. Jugular process of the condylar part. Now, see, some of the students are having this confusion that jugular process is a different part of your occipital bone. No, you have to keep this thing in mind that we are talking about the basilar part of your occipital bone, we are talking about condylar part of your occipital bone, and we are talking about squamous part of your occipital bone. Now, in this condylar part, this jugular process comes. So, where is the condylar part? So, I just told you these are the occipital condyles, clear? And this is your posterior fossa. Now, from here if you will draw the line, this is your, what is become? This is your condylar part. Now, in this condylar part, we are talking about the jugular process. So, jugular process is a part of condylar part of occipital bone, but it lies lateral to the condyles. That means these are the condyles, and lateral to condyle means this area. We are talking about this part which is laterally placed to the occipital condyles. Clear? Now, the anterior margin of these jugular process is free, and it forms the posterior boundary of your jugular foramen, and this margin is known as jugular notch. So, sometimes you have this question, what is jugular notch? So, jugular notch is nothing but this anterior margin is jugular notch. In the same way, this is the jugular notch. Clear? So, what is jugular notch? Jugular notch is nothing but it is the anterior free margin of jugular process. And what is jugular process? It is a part of condylar part of occipital bone, lies just lateral to the occipital condyles. Then this part articulate laterally with the petrous temporal bone. So, if you will go more laterally, this is the joint. This is the joint between the petrous part of temporal bone and the jugular process, which is a primary cartilaginous joint. Now, what is jugular foramen? So, you have to keep this thing in mind that jugular foramen is here. Now, this jugular foramen is contributed here by the two bones. This is the one and this is the another. Now, I just told you about this posterior part. What is this posterior part? It is known as jugular notch. Now, this jugular notch converted into the foramen by this anterior area. Now, this anterior area is actually the part of this petrous part of temporal bone. So, this is the junction, or you can say this jugular foramen is contributed by two bones. Clear? Generally, you will find the foramens in a one bone, like you will have the foramen oval, you will have the foramen spinosum. So, these are the foramen of sphenoid bone. But some of the foramens lies at the junction of the bones, like foramen lacerum, like jugular foramen. So, sometimes you have these questions, which of the following foramens formed by the joint or the fusion of two bones. So, this is one of the example. The posterior margin of this foramen is the anterior free margin of jugular process, and its anterior margin is contributed by the petrous part of temporal bone. So, it is situated between the jugular notch of occipital bone and the jugular fossa of the petrous part of temporal bone. So, now here in this image, what you are able to understand that this depression is not in the occipital bone. This depression is actually in the petrous part of temporal bone, and this depression is known as jugular fossa. So, there are two terms, one is the jugular fossa, another is the jugular notch. So what is jugular notch? Jugular notch is this posterior margin of foramen. And what is jugular fossa? This anterior depression, and this depression is a part of petrous bone. This boundary is a part of occipital bone. So this junction is known as petro-occipital suture, and the long axis you can say that it is directed again medially. Now at the posterior end of the foramen, its anterior wall is hollowed out by the jugular fossa, and this jugular fossa contains superior bulb of internal jugular vein. Now this is again the question for your exam, that this depressed area, which is known as jugular fossa, which is a part of the anterior wall of your jugular foramen or the fossa, contains what? Answer is superior bulb of internal jugular vein. Now here in this image, you can see that this is the dilated part of internal jugular vein, which is known as superior bulb. Inferior bulb present at the lower end of internal jugular vein. Clear? So at the upper end of internal jugular vein, you will have dilatation. This dilatation is known as superior bulb of internal jugular vein. Now in this, we are trying to understand the formation of jugular foramen. So here you have to first understand that this is your notch. What is this notch? This notch is nothing but it is an anterior free margin of jugular process. So this is known as jugular notch. Now these are the two depressions in the petrous part of the temporal bone. These are known as jugular fossa. So these are the jugular fossa. Now if we will join all these two areas, there is a formation of jugular foramen. Clear? So what are the structure passes through the jugular foramen? So the first thing which you have to understand, that jugular foramen divided into the three part. In the first part, you will have the anteriorly, you will have the inferior petrosal sinus. In the middle part, you will have very important content, that is the 9th, 10th, 11th cranial nerve with the meningeal branch of ascending pharyngeal artery, and posterior part is having the sigmoid sinus that will continue with the internal jugular vein, and also you will have the meningeal branch of occipital artery. So first thing which you have to understand, that this whole area has been divided into the three part, anterior part, then you will have the middle part and the posterior part. So in these three areas you are having the three contents. First is inferior petrosal sinus, then you will have 9th, 10th, 11th cranial nerve, and here you will have the internal jugular vein. So in this view, you have to understand that this is what is the outer line of your temporal bone. Now we have fade this temporal bone. Now once you will fade the temporal bone, inside the temporal bone you can see that there is a presence of S-shaped sinus which is known as sigmoid sinus. Now this sigmoid sinus will approach towards your jugular foramen. Now at the jugular foramen, this sinus will continue and it will come out as a internal jugular vein. So this is what you have to understand. Sometimes you have this question that sigmoid sinus continue as, answer is internal jugular vein, or internal jugular vein is a continuation of sigmoid sinus. But at the junction of the sigmoid sinus and internal jugular vein, you are having a superior dilatation which is known as superior bulb of vein. Now there are few important canaliculi are related with the jugular fossa. So sometimes you have these questions. So there are three canaliculi related. First is the mastoid canaliculus. Now the mastoid canaliculus is related laterally. Why? Because this is the mastoid process. You know mastoid process plays laterally. So but obviously mastoid canaliculus is present on the lateral wall of your fossa. Which fossa? Jugular fossa. Then you will have cochlear canaliculi. Now cochlear canaliculi present on the medial end of this hair, and this is present at the apex of the jugular notch. So this is your jugular notch and this is the apex of jugular notch. So it is having here. Then you will have tympanic canaliculus. Now this tympanic canaliculus opens near the thin edge of the bone between the jugular fossa and lower end of carotid canal. So when you will see the carotid canal, now this is the carotid canal and this is your jugular fossa. So now in between them you have this thin bony plate. On this thin bony plate, you are having a very small opening, and this opening is known as tympanic canaliculus. So where you will find these three canaliculus, you will have the mastoid canaliculus on the lateral wall, you will have cochlear canaliculus at the apex of this fossa, and you will have tympanic canaliculus that is present between the internal carotid artery and anterior part of this jugular fossa in this bony plate. Clear? Now what are the structure passes through these three canaliculus? So mastoid canaliculus allow the passage for auricular branch of vagus nerve. You know that vagus nerve is the 10th cranial nerve. I told you that there are three nerves coming out, 9, 10 and 11. Clear? Now this auricular branch will come out and it will enter into the this lateral side into the ear. Clear? So this is the auricular branch, and this branch will enter through a small foramen which is present in the lateral wall, and that is known as mastoid canaliculus. Then you will have cochlear canaliculus. Cochlear canaliculus, I told you that it is present here, and this cochlear canaliculus is having a connection with the intracranial connection for your perilymph, and that will present in the aqueduct of cochlea. Then you will have the tympanic canaliculus. Now tympanic canaliculus is present here. Now this tympanic canaliculus allow the entry of tympanic branch of glossopharyngeal nerve, and you know that this tympanic branch of glossopharyngeal nerve enters into the middle ear cavity. So this is your 9th cranial nerve. From the 9th cranial nerve, a nerve will arise, and this nerve will enter through this canaliculus inside the middle ear, which is present in this part of your temporal bone. Then what next is that you have one more bony projection is known as styloid process. So styloid process is a projection present from the temporal bone, and this is also present in the norma basalis. Now this styloid process give attachment to the three muscles and two ligaments. So these are the styloglossus, stylohyoid and stylopharyngeus muscle, and stylomandibular and stylohyoid ligament. And the most important thing is that the styloid process laterally related with the facial nerve. So now in this image, you can see the two ligaments. One is, this is the styloid process. Now one ligament is extending to the posterior border of the angle of mandible. So this is known as stylomandibular. And there is a ligament which is going to the hyoid bone. So this will become stylohyoid ligament. Now when you will see the muscles, now these are the three muscles which are going to the three different areas from the styloid process. So first is, this is the tongue. So this connection between the tongue and the styloid process. Now this is the connection between the tongue and styloid process. So but obviously this will become styloglossus. Then you will have a muscle going to the hyoid bone is known as stylohyoid, and this is the muscle which is going into the pharynx. So this muscle is known as stylopharyngeus. So stylopharyngeus is having the highest origin from the styloid process. So this is the stylopharyngeus, then you will have styloglossus, and then you will have stylohyoid. So these are the three muscles coming from the styloid process. Now in this diagram you should able to understand the difference between the stylohyoid muscle and stylohyoid ligament. The name is same, but when you will see this attachment on the hyoid bone, you have to keep this thing in mind that there is a muscle is present between the hyoid bone and the tongue. Now this is known as, the muscle is known as hypoglossus. It is a connection between the hyoid bone and tongue. So what is the name of the muscle? Hypoglossus. Now what is the difference between the stylohyoid muscle and ligament? You can see that the ligament is here in green color, and this ligament is going downward, and you can see the lower end of the ligament is here. So it is going deep to this hypoglossus muscle. But this muscle, this is stylohyoid muscle. So this stylohyoid muscle is not going deep to this hypoglossus muscle. So this is the important difference. So this stylohyoid ligament lies deep to the hypoglossus muscle, and the stylohyoid muscle lies outside the hypoglossus muscle. Clear? So this is the one thing which you have to understand. Now the next is stylomastoid foramen. Now when you will see the again inferior side or the norma basalis which we are talking, this is the styloid process, and then you will have, this is your mastoid process. Now in between them you will find a small foramen is known as stylomastoid foramen. Through this foramen, here you can appreciate there is a presence of a nerve, and this nerve is known as facial nerve. So this is most commonly asked question. Facial nerve come out from which foramen? Answer is stylomastoid foramen. So the stylomastoid foramen is situated between the styloid process and the mastoid notch, and it allows the exit of facial nerve, and there is an entry of stylomastoid artery. Now the last thing is mastoid process. Now when you will read the mastoid process, there are two questions comes from the mastoid process. First thing is, what is the structure attached on mastoid notch? Now when you will see the mastoid notch is present on the medial side of mastoid process. So this is the inferior surface. Now this is the outer surface of your mastoid process, and this is the inner surface of mastoid process. Now in this inner surface of mastoid process, you are having a notch which is known as mastoid notch. And this mastoid notch provide attachment to the posterior belly of digastric. Now here you can see that this is the common tendon which attached on the hyoid bone, and from this tendon you are having the two part. One is known as, this is the anterior belly, and here is the posterior belly of digastric. Now this anterior belly attached on the mandible bone, but we are talking about the posterior belly. The question comes here about the posterior belly. So this posterior belly, you can see that it is attached on the inner side of mastoid process, which is known as mastoid notch. So the question comes is that which structure lies in the groove or the notch present on the inner side of mastoid process? Answer is posterior belly of digastric, and that's why this is known as digastric notch. Apart from that, medial to the digastric or the mastoid notch, you are having one more structure, and that is known as occipital artery. So there is a groove is also present, and the question again is become the same, that the groove next to the notch is for, answer is occipital artery. So in this image you can see that this is the notch which I am talking about, and this notch is provide attachment to the posterior belly of digastric. Next to the notch you will have a groove, and you can see in the groove this is the occipital artery. We know that occipital artery is a posterior branch. Occipital artery is one of the posterior branch of your common external carotid, and this artery is going like this to supply the posterior part of the scalp. Now this artery is making a groove here, and this groove is lies just next to the mastoid notch. So this is the posterior view of your base of skull. Now where you can see that this is the notch. Now in this notch you are receiving the muscle is known as posterior belly of digastric. Next to the notch you are having a groove. Now this groove is for the occipital artery. Clear? So this is one thing which is again the question for your exam. So at the end of this posterior most part of the norma basalis, first thing is you should know the structure in the midline, and then you should know the structure which are present on the sides. Apart from that, you should have very clear-cut idea about the formation of jugular fossa or jugular foramen. Second thing is that you should know about how to divide the foramen magnum. Foramen magnum is the anterior part and posterior part. You should know the structures which are passing through the different areas in the posterior part of norma basalis. So by the end of this third part, we have finished the norma basalis completely. So this is all for the session. Thank you.